Today we are going to tell you about occupational therapy. Many people have misconceptions about the field of occupational therapy, so we are here to set the record straight. Misconception number 1, occupational therapists are the people who help you find jobs. Although occupational therapists can assist individuals in preparing to go back to work, we are not resume readers and we do not find jobs for you. Misconception number 2, occupational therapy and physical therapy are the same thing. Although occupational therapists and physical therapists work in similar settings with similar populations, we serve our own unique roles in a patient's rehabilitation journey. Misconception number 3, occupational therapists only work with upper body injuries. Although occupational therapists do work on your upper body, we also work on lower body injuries that are restricting occupational engagement. So what exactly is occupational therapy? The definition of occupational therapy that can be found on the American Occupational Therapy Association's website is, occupational therapy is the only profession that helps people across the lifespan to do the things they want and need to do through the therapeutic use of daily activities or occupations. Occupational therapy practitioners enable people of all ages to live life to its fullest by helping them promote health and prevent, or live better with, injury, illness, or disability. In summary, occupational therapy is helping individuals get back to doing what they want to do. Where do occupational therapists work? We work in schools, hospitals, outpatient clinics, nursing homes, mental health facilities, and home health. What medical professionals do occupational therapists work with? We work alongside numerous medical professionals, including doctors, physician's assistants, physical therapists, speech therapists, nurses, social workers, certified occupational therapy assistants, and more. What population do occupational therapists treat? Occupational therapists work with a variety of ages ranging from infants to older adults with diverse backgrounds. Some of the conditions we treat are neurological, musculoskeletal, and developmental. So what is an occupation? An occupation is anything an individual engages in to occupy their time. This encompasses self-care, leisure, and work activities. When an individual encounters a roadblock in their lives that hinders them from engaging in these occupations, an occupational therapist is just the person for the job. Now that you know what occupational therapy is, we want to tell you how it all got started. But we don't want you to take our word for it. We want you to hear it from 2 individuals that were there when it all began.
Hello, my name is Dr. William Rush Dunton Jr., and I am known as the founding father of occupational therapy.
And my name is Eleanor Clark Slagle, and I am known as the mother of occupational therapy.
In 1915, I realized the healing benefits of occupational therapy for individuals, so I created a manual for nurses that explains how OT can be implemented in practice. Then, in 1917, my friend George Edward Barton and I organized a society for occupational therapists known as the National Society for the Promotion of Occupational Therapy, or NSPOT. On March 15th, the NSPOT met for the very first time. Other individuals in attendance were Thomas Kidner, Isabel Newton, Susan Johnson, and Eleanor Clark Slagle. My friend George served as our first president. Our members came from very diverse backgrounds. They were physicians, secretaries, social workers, teachers, architects, and nurses. However, we all had a common understanding of the importance of occupational therapy.
In 1913, I helped create the occupational therapy program at Johns Hopkins Hospital. I then opened the Henry B. Favell School of Occupations in Chicago in 1915, which was the first occupational therapy program. This helped establish occupational therapy as a legitimate career within the medical field. As William stated, I was a founding member of the NSPOT. I was the president from 1919 to 1920. The organization changed its name to the American Occupational Therapy Association, or AOTA, in 1921.
During World War I, the military recognized the importance of occupational therapy with wounded members. These medical professionals were known as reconstruction aides. The reconstruction aides utilized arts and crafts to help the members in their rehabilitation journey. Then, in World War II, treatment shifted from arts and crafts to activities of daily living. The benefits that the members received from occupational therapy services greatly influenced the expansion of occupational therapy. Soon, occupational therapy was being recognized around the world as a successful medical treatment. Over the years, occupational therapy has grown to include a variety of interventions implemented across multiple settings.
My name is Wendy Hildebrand, and I am serving as the current AOTA president. Today, I'm going to tell you about Vision 2025. Vision 2025 states, as an inclusive profession, occupational therapy maximizes health, well-being, and quality of life for all people, populations, and communities through effective solutions that facilitate participation in everyday life. The 5 pillars of Vision 2025 are effective, leaders, collaborative, accessible, equity, inclusion, and diversity. Effective. Occupational therapy is evidence-based, client-centered, and cost-effective. Leaders. Occupational therapy is influential in changing policy, environment, and complex systems. Collaborative. Occupational therapy in working with clients and within systems to produce effective outcomes. Accessible. Occupational therapy provides culturally responsive and customized services. Equity, inclusion, and diversity. We are intentionally inclusive and equitable and embrace diversity in all its forms. Today, we have shown you that occupational therapy is a field that has grown immensely over the years and is extremely diverse. This diversity can be evidenced in 4 of the occupational therapy students at the University of Oklahoma Health Sciences Center.
I want to work with veterans who have PTSD.
I want to work with climbers who have neurological disorders.
I want to work with children with developmental disabilities.
I want to work with the general population in rural western Oklahoma.
Pressure.